Good morning, everyone. How are we this morning? I'm fabulous. Thanks for asking. My name's Anita, and I am a peer mentor resources support officer. I know it's the longest title in history with SBHQ, and I'm here this morning with Dr. Pamela Seaton. Good morning, Pamela. How are you today?
Morning, I'm well, thank you.
Thank you for giving us some time today. We're going to talk about pain management. Today it's a big topic around the SBH community. So I think we'll dive right in. And I just wondered about, because we've been working together for some time, but I wondered about your credentials and how long you've been in this industry, if you could tell our members about that.
Okay, so I'm a clinical psychologist, and so I specialise with working with people with moderate to severe difficulties. I have actually my doctorate was regarding issues around pain, chronic pain.
Oh,
Which is,
wow.
yeah, you didn't know that? Okay.
Excellent.
Okay, so that was I don't know, probably 18 years ago, something like that. So I've been working with people with chronic pain, not exclusively, but over the last 18 years. I worked in, in those first few years with the Brisbane Royal Hospital Pain Clinic. That's where I did one of my internships.
Okay.
So it was really a good experience working with a multidisciplinary team there.
Oh, great. So
Yes.
basically, you know a little bit about pain management, I'm going to say. So what do you think are the key concepts when we talk around pain and having spina bifida and hydrocephalus? When should we start to document or describe our pain to our physicians?
All right. So I've made a few notes. So excuse me.
That's totally fine.
It's a complex area, actually. And I suppose some of the key concepts are that chronic pain is specific to the individual, okay? Because there are many things that contribute to a person's experience of chronic pain. So
Yeah.
there are things like environmental factors. Of course, there are things in terms of physical difficulties or emotional difficulties. Also, what their social life is like, how much social support they have that contributes or influences the experience as well. The cognitive ability, so your ability to problem solve and your insight into what might be predisposing your experience of chronic pain. There's also, of course, life factors that are involved in that. So that's things that happen to us in life that usually we don't have any control over. But they impact, all of these things impact on our experience of pain. And that is very, very individual because no two people have the same experiences.
Yes. We talk about that with spina bifida and say it's like the snowflake disability because no two people are the same. You could see me, you could see three other people and we'll all be very different, even though we all have spina bifida and or hydrocephalus. So it's never too late to learn about pain, is it?
No. And actually, I think as early as a person can be helped to be aware or improve their body awareness, so they're sensitive to how their body is feeling, where they feel tension, where they feel pain. That's important too. And even as young children, you can use a simple scale by just saying, identifying what's the worst pain you've ever experienced and give that a number. For children, it would be 3. For adults, it would be 10. And then you say, okay, compared to that, where is your pain at the moment? Okay, is it a 1? for 2, for 3, or for an adult right up to 10?
Yes, yes. I've used that. That's
Yeah.
what my doctors have asked me. So it's shocking when it's a 10, let me tell you. That's when my shunt is literally breaking down, or my neuralgia has gone through the roof.
That's right.
So
I just thought of another concept that's really important with pain management, and that is that pain, when you're talking about chronic pain and you think about pain management, it's not a cure. It's not going to make all of the pain go away, but it's about managing the pain to reduce it as much as possible, and then to learn how to function as best you can, to live the best quality of life that you can. Okay.
yeah,
I think that's really important.
I think so too. Quality of life is everything. So when you're speaking with clients, what do you use, the tools you use to decide to discern whether or not it's acute, or it's severe, or it's chronic, or it's referred pain even, and can you ascertain from that the effects that it is having on a person's psychological state?
Yeah, sure. Well, first of all, we use a comprehensive assessment that's pain specific. Okay, so we get a history, very detailed history, personal history, and which outlines, basically tries to describe the pain, when it started, what are the precursors to it, what triggers there are for the pain. We use various tools as well. There's a lot of different measures that we use. To give you some example, I've just got some here. Which I use is the chronic pain coping strategies, in the McGill pain questionnaire, the Osterey questionnaire. These all look at different things. And there's also the pain stages of change questionnaire, which is a really important thing as well.
Oh, okay.
Yeah. So that looks at where a person is at in terms of their approach to what they can do about their pain. Because some people feel that taking medication is all they can do, that there's nothing that they can actually do in their life that can have any impact on their pain. So it's a really good question to have a look at where they're at, because that helps then to identify whether we need to do some psychoeducation about what actually they can do.
Yeah.
Or whether they're ready at that action stage to get in and do the things that we can suggest. Yeah.
Thank you, because I think it's important for members, particularly when they're transitioning and their parents aren't necessarily in rooms with them, to be able to, just if the physician is not doing those kinds of tests, then perhaps that's not the physician you need to be seeing at this time. I think it works two ways. I always like to know what my medical team are doing and that kind of thing. So
because it's chronic pain is very complex, so you need to take a team approach. So there needs to be your GP involved. There needs to be medical specialists there as well. Psychologists, definitely, because it has an impact. Psychology has an impact often with chronic pain, because of the impact on functioning. There's depression, anxiety, stress can develop, and that can become chronic. So a psychologist needs to be involved. Occupational therapists are involved. They can identify how the environment can be changed to minimize triggering off pain, and they can also identify various assistive technologies that can help with that. Sometimes a people with pain have difficulty with communication as well.
Yes.
So yes, so some help with speech communication is useful. Physiotherapists. So there's a range, you know, and there's also the for instance, at the pain clinics, they have the surgeons involved if that's necessary,
Sure.
psychiatrists as well to help with medication. So really the best management of pain, chronic pain, is to have a team that is working together to help you.
Yes, we've gone from the take a pill and go away sort of era to a holistic approach.
That's
So
right.
with that, what do you consider to be the three main things that our members at SBHQ can do for themselves to manage their pain so that it doesn't spiral into the abyss that is depression and anxiety and fear?
Yeah, I think first thing is to understand your pain. Okay.
Right.
With chronic pain, first thing is to realise that and accept that there's no absolute cure for it. You know, it's not about being totally pain-free.
Yeah.
It's about management.
Yeah.
And it's about learning how to connect with your body, to be aware of those first signs so you can get in early, apply strategies and techniques early.
Yeah.
And there are some strategies and techniques that need to be applied every day to manage pain.
Yeah.
It's really important. It's just like if you have depression or anxiety, you know, you need to do certain exercises, use certain techniques every day to keep it at a low level. Okay? Or yes, with that you can actually reduce anxiety right down at times, and sometimes depression. So that's really important to understand those things. So it's about including things in your lifestyle.
Right.
So working out what works for you, what the triggers are. And remember, there are a lot of triggers.
Oh, yes.
There are, when you're stressed or anxious or depressed, you are going to experience more pain than you would if you weren't experience those mood things, those tension. The main things that are found to be most effective in terms of strategies are activity pacing. So, you know, not going in full blown and working until the pain's too much, and then you stop and you're out of action for days or maybe weeks even.
Yes.
It's about working with your medications as well to pace your activities. So for instance, taking medication as prescribed is another thing as well.
Right.
I know a lot of people with chronic pain, they tend to wait until the pain is bad and then take their medication.
Oh, okay. Yes.
Okay. But with pain medication, there is basic medication that's usually prescribed for every 4 hours or every 6 hours.
Okay.
That's the best use of it. So then what you do with the activity pacing is you plan your activities that are going to be a little bit more physical. If it's, to do that, within half an hour or after you've taken your medication and it's kicked in.
Yeah.
So you do those activities then. Then usually with when you take your medication on a 4-hourly basis, the first 2 hours you can do your activities, then stop doing those.
Right.
Then you have a rest because your medication is weakening. Okay, and then when you take pain medication again, then you do some more activities. You'll find that by doing that, you get more done that makes you feel better about yourself.
It does.
You've achieved something, you're able to do, you're functioning as well as you can. Whereas if you just work until it's no longer bearable,
Sure.
and and you put yourself out of action for a long period of time, again, that's when depression and anxiety can jump in, and that makes the whole thing worse.
Yeah.
So the activity pacing. The other thing that research has shown is that having social support around you really reduces the experience of pain. So not feeling, oh, I can't go out because it's painful.
Yes, which is our first natural reaction, I've got to say. The last thing I want to do is go to a movie with friends when I've got a blinding headache.
Yeah, that's right. And that's so with any pain. If we've hurt something, or even people with arthritic pain, they don't want to move those joints, but the best thing they can do is move those joints. So having giving yourself opportunities to develop friendships, to develop like a social network if possible, getting out, doing things again, you can connect that with your activity pacing. If you want to go to a movie, do it after you've taken your medication. So you can enjoy that movie. You're not in the highest level of pain that you do experience.
Yes, because it can, for social interaction, it can work both ways. I know when I've said in the past to my friends, oh, I'm just not up to it, the next time they don't tend to invite me. Because they think, oh, no, she's in a world of pain right now. She doesn't need to go and have coffee. But you're saying that I possibly really do.
Yes. And this is it, just by being with friends, being with people who care, and talking with them about other issues and things, that helps with your pain. So it helps to reduce your perception of your pain. It's still there. It's manageable, and you can still have an enjoyable time with that. But as I said, balance it with your activity pacing if possible. So for instance, if you're on a number 10 with pain, and someone invites you out to coffee, you might say, well, I can't, I'm not really up to it right now. How about we meet this afternoon?
Yes.
For coffee. Don't put it off completely.
Well, thank you. That actually makes really good sense.
It's about managing your life.
I guess we're just used to what we're used to, particularly older members. I know I'm getting a little bit older now, so all these techniques, we didn't use them I didn't use them when I was in my 20s and teens. You took a Panadol, that was it. So it's very interesting. I'd like now, if we can, to move on to neuroplasty or neuroplasticity. I never know which one is correct. It's a relatively new technique, I think. Can you explain a bit about that?
Okay. All right. We used to think that our brain develops the pathways that we have in the brain, the neural pathways, and that they become hardwired, and by the time we're adult, then we can't really shift them. But we do know now that neural pathways and systems can change, and we have an influence on that.
Right.
Sometimes what that means is, like, you think about a person who has visual impairment. Okay, those pathways are compromised. The visual pathways are compromised. But what happens is other pathways in in the brain become more sensitized and take over,
Okay.
abilities of some of those things. So that means that hearing, smell, sensory stuff is more developed. Okay.
Okay.
We also know that even people, there have been cases where children in particular have high neuroplasticity. So with some children who has damage to, say, the speech area, or what we think are the speech areas of the brain,
Right.
their brain has been able to develop, the parts of their brain in other areas have been able to develop so they actually don't lose their speech. And it's astounded some people how that works. So it replaces some of the functions. Some of our neural pathways are able to develop to replace some functions.
Yeah.
With
Yes,
because have been damaged. It's more, it's stronger that in children.
right.
Yes, we have some impact as adults too. And it's the same, in psychology.
Yes.
Definitely in psychology. The way we learn is we create new neural pathways each time we learn something new. So, and if we don't use pathways that are unhelpful to us, so for example, unhelpful thought pathways,
Yeah.
deteriorate and they fall apart. So
Right.
they no longer become our default thought. So for instance, if in terms of pain, if you're experiencing pain, a default might be that, I'm never going to be able to do anything. Life is terrible. If you focus on that thought, that strengthens that neural pathway.
Sure.
So every time you feel any sort of pain, your thought is going to jump to that pathway. So if you notice that when that's happening, when it first happens, then consciously create a new pathway, thinking, oh, maybe an alternative to that is, okay, I'm feeling some pain now, but I know what to do. Maybe I need to rest, or maybe it's not too bad. I'll just ring a friend and help me. And so that's a new neural pathway. Focus on that. That strengthens that one. That will eventually become our default pathway.
Yes.
So when we
And I truly believe that does work.
Yeah, it does. It does. Yeah.
When I was in a world of pain, before I did my meditation, and just to calm my brain, even music, can calm you.
Yeah.
Or writing about it, keeping a journal, and that also helps when we're not together. I can write a little thing about when I was in pain and what pain it was and how I felt about that. And then we can talk about it in rooms. And, it's something that I can do for myself. Yes.
Exactly. And people forget that we have the ability to create thoughts. We're so used to just listening to the thoughts that pop into our head.
Yes.
But we can create thoughts, and that's creating neural pathways. And there are ways that we can activate neuroplasticity as well. So things like you mentioned music. Music activates neuroplasticity. We know with research that's been done with people, elderly people in aged care, music has stimulated memories that, brought them back. So it's affecting the processing that goes on in our brain, making it more, active, bringing back functions that we thought were gone forever, basically. Things, art therapy does the same thing. Okay.
Right.
Pets do the same thing.
Oh yes.
Okay.
Speaking of pets, I've been ignoring mine for about the last 40 minutes because she's just being naughty.
Yep. Let's see, things even like if you dance, that also, it's those creative things that stimulate neuroplasticity. Reading fiction,
Okay.
stimulate neuroplasticity too.
Yeah.
Let's see.
And that is the right brain, isn't it?
Yes, yeah.
Pamela? Yeah.
Yes. And this is it's not only individual pathways that we're thinking about, we're also thinking about connections, systems within in our brain. So that can be stimulated. So remember, with our neural pathways, they link areas of our brain, and in terms of chronic pain, physical chronic pain, and motor coordination, a large part of our brain is involved in that process. You know, I remember I was listening to a neurologist, and they were saying that practically 80% of the brain's functioning is involved in moving our body. Okay, so
I know, it's a lot.
Think about that, then you think, okay, if I can stimulate the connections between all of those areas of my brain, that's going to help, you know, with my body being able to move more appropriately.
Yes, because again, I mean, from birth, we've had this manufacturing fault, for want of a better term, and some of us have hydrocephalus only, and some of us have spina bifida and hydrocephalus, and then we found the Chiari malformation, the Arnold-Chiari malformation, and that has a lot to do with it, I'm sure.
Oh, absolutely.
The very old part of the brain, isn't it?
That's right, exactly. And, you know, with all of these conditions, they all involve the nervous system. Right. And so this is what our brain is. It's the center of our nervous system.
Yes.
Okay. And our nervous system carries the messages from our body and also through our thoughts. And just about every single message in our brain travels through the emotional area of our brain. Okay,
so feelings then can override thoughts.
Oh yeah, yes they can, but we can use our thoughts to balance those feelings out and manage those feelings. So we're more in control. It's not about stopping the feelings, it's about managing them and dealing with them in different ways. Okay, so that they don't control us. We pay attention to them. That's why we have them. We wouldn't have them if they weren't serving a purpose, and they are. They serve the purpose to communicate that something's quite not in balance in our life. You know, if we're stressed by something, it's our body and our brain saying, "Oh, wait, what? Stop!"
Yeah.
And okay, there's something not right here. Figure out what it is and see what you can do about it. And sometimes we don't have control over what we can do about it, and that might mean just letting it go, moving away from it, or accepting it and doing the best that we can.
Sure.
Okay, or not doing it now, doing it later.
It just later.
Listen to the emotions.
Oh,
to the
I know when I was younger, I probably did live by my emotions because I didn't understand some of the concepts that we're discussing here today.
Yeah.
Because I didn't actually, I don't know, but I don't think back in the early days in the 70s, and I'm talking 70s and 80s, these things weren't around.
No,
so you didn't even know that a person like you existed, you know. So I saw a neurosurgeon, a urologist, and an orthopedic surgeon.
Yeah.
And that was it. You know, nobody told my mum that perhaps I should visit a psychiatrist, you know. So I'm glad though that it has evolved so that we can do things. We don't have to live like lepers anymore and you know, sit in our beds all day and and do
absolutely.
nothing but focus on our pain.
Yeah, absolutely. And you know, I often mention to my, especially my younger clients, you know, that especially when I'm teaching them strategies and techniques that they can use, you know, I'll often comment, hey, you know, when I was young, I
Yeah.
Mum, and you know, there were psychologists. I mean, they were around, but we didn't, especially in Australia, we
Oh
just
no.
didn't go there, you know.
It was almost a shameful activity that
Yeah,
had to actually say, well, I need some help psychologically.
yeah. But particularly young people, you know, why do we have to learn from painful experience, you know, from that's what it, when we can be advised about things that are useful, not only in pain but in during our life. You know, if we just get a bit more information and a few more strategies, our parents, they help us the best they can, the best they know how.
Yes.
But professionals who are trained in these areas, they have more knowledge. So if it's not, if what we're doing is not completely working, or maybe even seeking, you know, a professional's advice, um, they're trained in these areas. They're trained in, yes, chronic pain, uh, the emotions of psychologists in particular. You know, that's our area. We are trained in emotions, behavior, and cognition.
Yeah.
And, you know, and
So,
we know how they.
sorry, you go.
That's all right. Go on.
Well, I was just wondering then, from that, what is the number one question that you wish people would ask you when they rock on up to your rooms?
Yeah, that's a good question. I've been given that some thought. I suppose what I like to see in my clients is I like to know what they would like to change in their lives, because psychologists are change agents. Okay, we help people change things they're not happy with in their lives.
Yep, you certainly helped me.
Yes. Um, and I would like them to um, to be motivated to try things. Okay, to I suppose that. So I suppose the question might be, you know, I've come. What can I do to help myself? Because basically that's what psychologists do. When you see a psychiatrist, you know, it's mainly about medication. And so what medication can help me, right? But when you see a psychologist, it's about what can I actually do myself to help myself.
Mm.
And that, when I hear that, that's great, because I know they're going to use the strategies, they're going to use the techniques, they're really going to be involved and committed in their own well-being. And that's great. It's great to work with people like that. Yeah.
There really is this old saying of no pain, no gain. So I guess, yes, I would also back that up as a patient, to say to people, you know what, it's okay if you try something different. If you're open to it, then it might just work for you. And we might take 6 months to figure that out. Might take 6 years, but at least be open to some of the newer concepts, because it's not all, you know, waffle. It's scientific evidence based study. You know, I don't sit on your couch and tell you about my life. You know, that we're long gone. So yeah. So thank you for speaking with us today, giving up your valuable time and all your amazing insights. I'll let you have the last word. Any last words?
there's always something you can do to improve your life, always, to improve your experience. You just have to find it. And you remember, your individuals and your professional helpers are individuals too. So even if you don't strike the right one for you, first off, keep looking, because you'll find someone that you can click with and who can help you.
Yeah. Again, I concur. I went through, I shouldn't say went through, I went to 3, I think it was, before I found you. And whilst they all taught me something, it's just nice to be able to say, well, yes, I found this person eventually, rather than, oh, I never actually found that person, or even I didn't know that person existed, as a physician. It's just the same as our neurosurgeons, our urologists.
That's right.
It's exactly the same.
Yeah. It's a team approach. So you all have to work as a team and get on as a team. That's important.
Yes. Well, thank you.
You're welcome.
And maybe we'll talk again soon.
Okay then.
Thank you.
It's been a pleasure.